All right, let's jump right into this explainer. Today, we're confronting a massive, largely hidden crisis inside Ethiopia's healthcare system. But more importantly, we're looking at the AI revolution that's poised to actually fix it. We are digging into a really fascinating feasibility study for something called the Integrated Smart Healthcare Solution, which is being proposed for the Oromia region. And let me be clear right up front. This isn't just about upgrading a few computers. We're talking about fundamentally changing how human lives are saved.
We have to start with a really tough number, 52,400. That is the estimated number of people who die every single year in Ethiopian hospitals from preventable causes. Let that sink in. These aren't inevitable medical outcomes, and they aren't untreatable diseases. They are systemic failures. Basically, these are lost simply because the exact right information didn't reach the exact right person at the right time.
And the financial drain? Well, it's just as massive. Roughly 90 billion Ethiopian birr is lost annually to direct medical waste and lost productivity. Because of massive inefficiencies in the current system, patients end up stuck in the hospital for over 8 days longer than they actually need to be. It's just a staggering drain on both the economy and the local healthcare infrastructure. So here is how we're going to unpack the Integrated Smart Healthcare Solution, or ISCS. We'll look at the cost of manual care, why this is way more than a call button, direct AI integration, custom ward protocols, and finally, the massive Oromia rollout plan. Okay, Section 1, the cost of manual care and systemic failures. To really understand this crisis, imagine you're a nurse relying entirely on your own memory during a grueling, chaotic shift. Human memory and paper charts are actively failing both the patients and the staff. The data shows an astonishing and, frankly, terrifying 50% medication error rate. Literally 1 out of every 2 medications is incorrectly prescribed or administered. Why? Because the staff is completely overwhelmed and the system relies almost entirely on manual memory. There's zero real-time machine data tracking to back them up. And to make matters worse, the heavy reliance on the internet means that existing digital systems just completely fail in rural areas the second the connection drops.
Section 2, more than a call button, active patient care.
Now, when you hear the phrase digital health, you probably picture a basic nurse call button next to a bed, or, I don't know, maybe a digitized checklist. But ISCS is a totally different beast. It's an active, AI-powered clinical protocol engine. It actively manages patient care. It doesn't just beep to say someone needs help. It literally tells the nurse exactly what step-by-step clinical actions they need to take the second they look at the screen. But here's the catch. There is a super strict hardware requirement to make this work. The system absolutely cannot run on Android tablets or web browsers. Why? Because Android and web platforms rely on cloud middleware. That creates dangerous delays, sometimes taking up to 10 seconds to respond, and it actually compresses vital patient data. ISHCS strictly mandates Windows devices. Windows guarantees direct machine communication, effectively zero delay, and most importantly, it stores exact data offline. So the system never ever goes down, even if the Wi-Fi completely cuts out.
Let's look at Section 3, direct AI integration and zero human delay.
The way data flows here is honestly fascinating. Step 1, the medical device, like a ventilator or heart monitor, reads the patient via a static IP address. Step 2, a local Windows tablet mounted right at the bed listens directly to that machine. Step 3, the AI analyzes that raw data locally on the tablet. And Step 4, an alert instantly hits the nurse station. The AI pulls vital signs directly from the machine to the local tablet in under 100 milliseconds. It entirely bypasses human entry, meaning absolutely no transcription errors. And it does the whole shebang without needing a drop of internet connection. Moving on to Section 4, custom ward protocols and AI-guided nursing. This is where the system absolutely shines. Instead of just pinging a nurse, the AI provides highly customized, ward-specific instructions. Think about a nurse in the pediatric ward at 3 a.m. They don't have to do mental math while exhausted. The AI calculates the exact weight-based dose, explicitly showing that, for example, 15 milligrams per kilo for an 8-kilo infant equals a safe 120 milligrams. In ICU, it actively prompts the staff to check ventilator 2 placement every single hour. In isolation, it literally blocks the protocol until the exact required PPE, like an N95 mask and gown, is visually confirmed. It just completely lifts that heavy cognitive load off the medical staff. Plus, there is an incredible level of accountability baked right in. Every single action a nurse takes is logged via a unique QR code. And if an emergency happens to go ignored for 20 minutes, well, a strict escalation protocol takes over. The system doesn't just passively keep blinking. Actually, it automatically escalates the situation by firing off an SMS directly to the head nurse. Basically, no call can slip through the cracks.
Finally, Section 5, the Oromia rollout and its 5-year implementation plan.
The sheer scale of this ambition is wild. The Oromia Health Bureau is aiming to deploy one Microsoft Surface tablet for every single bed across more than 70 public hospitals. We're talking about outfitting 3,500 beds across 10 distinct types of medical wards. The goal is to create a completely unified, AI-driven digital net across the entire region.
But you can't just flip a giant switch and turn this on everywhere at once. This massive 3,500 tablet deployment is logically phased over a 5-year timeline. It moves systematically, zone by zone. Year 1 starts with deploying 1,000 tablets in Jimma and Showa. By year 5, the rollout reaches Barina and Guji. This deliberate pacing is absolutely crucial because it allows time to properly train over 7,000 nurses on the new Windows hardware. So, to actually pull this off, the total proposed budget is 240 million ETB. Exactly half of that investment goes directly into the physical infrastructure, buying those essential Windows tablets, the servers, and the bedside mounts. The rest is really carefully balanced across software licensing, physical installation labor, and, of course, the training and support needed to ensure the hospital staff actually adopt the technology. Here's where it becomes an absolute no-brainer. The financial ROI is staggering. We're comparing a total 5-year investment of 240 million ETB against a conservatively projected annual savings of 27 billion ETB. Even if the system reduces those medical errors and prolonged hospital stays by just 30%, the financial savings are so massive that the entire system pays for itself in less than a single year. Oh, and that's not even counting the 800+ new tech jobs it creates nationally. I want to leave you with a final thought to ponder. We started today by looking at 52,400 preventable deaths and tens of billions of birr wasted every single year. When the AI technology exists right now, today, to completely eliminate manual guessing, human memory lapses, and system delays, is the true cost of this revolution simply the cost of inaction? When a solution can pay for itself in a year and save thousands of lives, how quickly must this become the global standard?